Welcome everyone to today's webinar. I am Mackenzie Bean with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Rami G. Hanna serves as Vice President of Supply Chain Management at Centura Health. In this role, Rami oversees supply chain management for all hospitals, physician practices, senior living facilities, and home health services. Rami also has oversight of Centura Pharmacy, Biomed, Labs, and the medical credentialing offices. Rami joined Centura Health in 2001 and has served in numerous financial, operations, and facility management roles for Centura Health hospitals. Rami was named Vice President of Supply Chain Management in January 2013 and is currently overseeing efforts to standardize service costs and decrease costs at the clinical level. He graduated from Wichita State University with a bachelor's degree in business administration, accounting, and entrepreneurship, and a minor in finance and economics. He received his master's degree in business administration with an emphasis on operations from Regis University. John Roy, General Manager for Cardinal Health Inventory Management Solutions, has been with Cardinal Health since 2003. As General Manager for the enterprise-wide inventory management workflow and point-of-use solution that drives efficiency, reduces cost, and brings intelligence to supply decision-making, John empowers his team to develop solutions addressing optimization challenges at the top of customers' minds. John also has experience in marketing strategy, operations, business development, and sales, and is a Lean Six Sigma Black Belt. John received his Bachelor of Science in Business Marketing with an additional major in psychology from The Ohio State University. John, I'll now turn the floor over to you.
Awesome. Welcome, everyone. It's really exciting to be here today. So my mission with our organization is to bring full visibility, control, and intelligence across the product lifecycle within a hospital and solve some nagging workflow issues along the way. I assume these challenges are top of mind for many of you on the call, and I'm happy to have one of the more visionary institutions with me here today, Centura Health, represented by Rami Hanna, their VP of Supply Chain Management. Rami's been with Centura nearing 2 decades and has led a cultural evolution with focus on standardization, reducing the cost of care, and bringing the most value to his clinical partners. I'm honored and excited to share some insights with you, but I'm also eager to learn a little bit from Rami myself. So over the next hour, he and I are going to dig into the continued pressures hospitals face to reduce spending while improving care. We know firsthand this is hard, and it's getting harder if you aren't being proactive, especially with the mounting complexities in health systems today. But Rami is going to share how leveraging analytics around the purchasing and use of medical products can open up the lines of communication between supply chain and clinical teams. And he'll show you how that transparency and alignment has resulted in knocking out a lot of waste from their system, while at the same time increasing the service his team provides to those delivering the care. So a couple things we'll hit on today. First, understanding the pressures on the hospital supply chain, applying best practices across inventory management, driving organizational alignment, and leveraging data to make informed decisions. Let's start, though, with a quick overview of Cardinal Health and Centura. So a bit about Cardinal Health first. As one of the largest healthcare companies in the world, we truly are essential to care. Many of our customers know us as leading healthcare logistics company. Some may call us a distributor, but honestly, I'm proud of that foundation. For decades, it's enabled us to support the entire supply chain and ensure providers can rely on having the products they need when they need them, and we've continued to learn and innovate. But with healthcare continuing to evolve to be a true partner enabling the most efficient and highest quality of care, we have continued to build on that foundation while branching into many other solution areas. We have one of the largest portfolios of medical products that range from gauze to surgical gloves all the way to some of the most advanced cardiovascular devices on the market. Our business solutions focus on optimizing processes and performance through things like consulting, staffing services, regulatory and compliance support, and we even touch patients with medication therapy management, post-acute discharge planning, and even product deliveries to the home. Across all of these, Gartner's recognized us as #1 in supply chain innovation 4 years in this decade alone. But at the same time, we've tried to stay humble, as there are a lot of challenges in healthcare that have yet to be solved. And we're always looking to partners like Centura to collaborate with us, bring their ideas, bring their pain points, and see if we can solve them together. So Rami, why don't you give an overview of your company?
Thanks, John, and thank you for the great introduction. I'm pleased for this opportunity to share with hospitals our struggles and barriers we have faced as we've embarked on building a stronger supply chain within our IDN. Here's a little about Cardinal Health. Cardinal was formed in 1996 by Adventist Health System and Catholic Health Initiative. We have 17 hospitals that span across the state of Colorado and through western Kansas, plus 13 affiliate hospitals. We have more than 100,000 annual admissions and perform 100,000 annual procedures. We have 1.4 million physician and ambulatory visits. From the supply chain perspective, like most hospital systems, our high supply spend occurs in cardiovascular, IR suites, and operating rooms across all our locations, in which we relied on heavily manual processes to manage our inventory. Where our supply levels are significant, based on our spend and activity, we believed one of our first priorities was to tackle inventory management. We looked to our cardiovascular and IR suites as the start. John, I've given an overview of our hospital and supply chain. Can you share challenges in health systems like us at Centura that hospitals are facing today?
Absolutely, Rami. So the healthcare industry today is in the midst of unprecedented change, which is making things more complicated than ever. With the aging baby boomer generation, we are seeing a tremendous spike in the demand for care, which is outpacing the educated and trained staff to care for them. We are also starting to see a rise in consumerism. That's where the patient is becoming more empowered with choice, which is pressuring the systems for transparency and increasing focus on ensuring our patients are satisfied with the care that they receive. Here in the U.S., regardless of your political affiliation, it can be agreed that our overall expenditure on care has become challenged, especially that being managed by the government across Medicare and Medicaid. We are seeing some aggressive measures being put in place to limit costs, while also expanding care to more of the population. I'll call out one of the largest change drivers specifically, though, and that's the shift to value-based care models. Historically, providers have been paid to use more and do more in a classic reimbursement model, which drove a heavy consumption-based system. However, this wasn't a system that by default drove cost containment. So what we are seeing now are more payment models being based on an entire episode of care, ones that track patient outcomes even months after the procedure. An example of that is the new CJR for hip and knee replacement, which has mandatory bundled payments for over 700 hospitals, and I assume many of you on the call are already impacted by that. These payment systems are capitated, where the provider is paid a lump sum regardless of the magnitude of products or care initially provided, and that provider is also on the financial hook if that patient gets readmitted within a set time period. These shifts in payment types put even more pressure on providers to manage their total cost of care. Historically, supply chain and sourcing teams were focused on driving down the price of products. However, it's now critical to look at all process costs, such as inventory management, supply and clinical workflow, patient discharge, and room changeover. Unlike in years past, advances in technology are now enabling optimization practices across all these areas through improved data visibility. When looking at improving the overall cost of care for patients, it's impossible to ignore the broader supply chain, though. When you add up all the waste in North America, it's over $5 billion a year. And that's both manufacturer and provider wasted labor, excess inventory throughout, wasted products from expiration and obsolescence, and missing data preventing optimal procedure-based revenue. And the worst part is that's no longer a shocking statistic, as it's been well known for about 10 years. The catch is that while there are logical actions to be taken, the biggest limiting factor has been the lack of data visibility throughout, especially for providers. Hospitals know that they need to do something, but the methods to fix things aren't nearly as well established. So that $5 billion is a massive number and almost too big to really hit close to home. So let's look at things a little bit more specifically from a bottoms-up provider view. Most providers have a very solid grasp on what they purchase, but many have little visibility to where those products are stored, when and if they've been used, and even on whom they've been used. Because of this, providers often carry about 25% excess inventory, largely due to the understandable overreaction of trying to ensure the right product is available when it's needed. This behavior also leads to a tremendous amount of expired product, which we've seen exceeding 3.5% of total spend, which is millions for many institutions. A recent survey conducted by CERMO of hundreds of hospital, clinical, and supply staff indicated more than half of those surveyed recalled a time when a physician did not have a product that was needed for a patient during a procedure. Most concerning, almost 20% were aware of a patient being harmed for not having the right supplies at the right time, and that nearly 25% had seen or heard about expired or recalled products used on a patient. These stats are scary, especially when every single one of us on the call is a patient. Not only do we have to fix these outputs, the amount of time managing these processes is also problematic, especially when clinicians are largely tapped to play a key role in them. And I would argue that every minute a clinician spends on non-clinical work is time robbed from patient care. Multiple sources show that nurses spend up to 25% of their time on non-direct care, such as doing paperwork or managing supplies. And in another survey, almost 20% of nurses identified locating supplies and equipment as their biggest time waster. Overwork and frustration can lead to higher nurse turnover, which then leads to costs the hospital more time and money, and the cycle of waste continues. Finally, and most importantly, consider the impact on the patient. It's proven that a higher proportion and higher number of hours a nurse spends specifically on patient care is tied to better overall care, and that should be pretty obvious to everyone. You take all of these stats into account, and I think we can all agree that a more efficient supply chain can lead to reduced costs, happier nurses, and healthier patients. So that's enough of my opinion. Let's see what you're all thinking with a quick poll. So, what's your biggest personal challenge with the current healthcare evolution? Achieving aggressive short-term financial goals, labor shortages affecting capacity and talent, improving patient care and outcomes, having the right data to make informed decisions, or staying on top of process and technology innovation? Awesome. So as we see results come in, it seems that there's a decent split. Everybody has some challenges in some different areas, which gives me some confidence that they're all an issue. At the same time, it really seems that lack of data availability is what's limiting you all from making the decisions that you feel like you need to make. So, Rami, maybe you can share some challenges you've struggled with.
All great points, John, you point out. We can definitely relate. In addition to John's points and struggles you called out in the poll, Cardinal Health had and still has some of our own unique challenges within our supply chain across our system. We're using manual processes to manage all our bill-only inventories for all our facilities. I often refer to it as the great paper chase. While this may be hard to believe, I have learned throughout this process that the manual approach is all too common in many of our hospitals, and today it's a horrible burden. We knew we were struggling, and we knew we had to find a new approach. As a result of the manual efforts, we had lack of visibility to supply levels, both purchased and consigned. Consumption patterns were questionable. Recalls or expirations were often missed, significantly hindered, and efforts on forecast planning. You name it, most likely we struggled with it. Finally, a common challenge which I knew can be common with my colleagues was misalignment of priorities, an uncertainty of responsibility across cross-functional teams. We knew we needed to find a tool that allowed supply chain leaders to manage supplies and allowed our clinicians to focus on our patients. For instance, regarding PPI, it was common for us to take the data to the clinician and say, you have too many SKUs. You can save X, but the conversation wasn't successful because the priorities are patient and patient cost. When we aligned clinicians to the desire with our own, using tools like Epic and improved reporting, we're able to sit down with docs and nurses and show them contribution margin, start a dialogue, which would enable to inform the clinicians on decisions on SKU and cost reduction. Knowing that we needed to tackle the problem, let's take a look on what we wanted to solve for. In order to address our inventory management challenges, we knew automation and real line of sight of data was imperative, but needed to hit several key priorities on our wish list. Number one, visibility of products across supply chain for multiple departments was a must-have. Improve ordering and ensuring right amount of inventory while reducing waste and expired products was a key, Ability to view data at procedural levels such as cost per case, supplier, and physician usage was a must-have. It also had to be scalable to grow with us as we changed. And we also recognized it wasn't going to be solved overnight. When reflecting on our journey, it reminded me the focus wasn't a one and done. It was going to have to be a consistent change. So with a lot of stakeholders involved, an alignment was critical. While I was the champion of this project, a lot of people needed to be involved to make it happen. And here's a glimpse on how the project worked. It was clear to me we all needed to lean in. Let me preface, it was baby steps. We took a lot of baby steps. This project started several months ago, and each stakeholder came to the table with their own priorities, such as eliminating product waste, visibility of product, documentation, integration with existing systems, protecting PHI. There had to be an ROI to the investment. The workflows had to be simplified. Clinicians had to go back to focusing on patient care, plus there are many more. If I was going to get support, I had to position the change to automation as an ROI focused on cost savings, service level changes, streamlining workflow, and increasing overall quality of care. The system leaders and clinicians also had to trust that we were going to deliver. And my team needed to buy in, which didn't happen overnight. But over time, confidence and switch in automation strengthened, and I was able to begin to demonstrate the impact and change would have to our health system, ultimately to our patients. While everyone did not start on the same page, we also needed alignment in roles and responsibility. To be completely transparent, our team initially didn't have the confidence that the cross-functional teams would hold up and their responsibilities, which went away quickly and alignment was achieved. Coming from a world of overstocked inventory and transitioning to having just enough was difficult to our clinicians to embrace, especially when it came to just trust supply chain. The following were and still are must-haves in achieving alignment. Clear roles. We all agreed clinicians needed to spend time with the patients and supply chain needed to spend time on focusing on supplies, providing a level of strategic direction for supply chain management we had not been able to do before. One common goal was quality of patient care. We emphasized this goal could be better achieved through clinician decision-making and predictable supply chain patterns. A phased approach was a must-have. We tackled this initiative bit by bit and advertised our small victories with initial pilot levels, which helped us gain buy-in to the momentum. Communication was key. Improved communication among cross-functional teams across the organization and Cardinal Health was a must-have. While we may have achieved the buy-in to make change, it was also key to execute. Before we take a poll, I must pause and tell you I honestly believe this approach is the new cost of doing business. We must be flexible with change. We must embrace the technology. If we all think pushing boxes is the way of the future, we all will not succeed in the new healthcare environment. With that being said, I'm going to pose another question to the group. What is your largest barrier in implementing change? A, achieving cross-functional stakeholder alignment. B, leadership capacity for conflicting priorities. C, determining the best solution and pattern. D, obtaining investment funds to implement. E, workforce resistance to the new method. It's interesting that the group is split between A, achieving cross-functional stakeholder alignment, and workforce resistance, which I would suggest to you is a large barrier for embracing progress, and culture would be key. John, can you give us an overview of automated inventory management and its benefits?
Absolutely, Rami. So there are a ton of benefits to automating inventory management across the full product lifecycle. Doing so can help bring together workflows between supply chain and clinical teams and drive a ton of efficiencies. PAR levels can be continuously analyzed and updated and can take into account seasonal shifts and changing patient and physician trends that are practically impossible to pick up manually. Ordering can be simplified and even automated if folks want, and orders can be tracked from requisition through receipt. Now, as much as we hate it, cycle counting is actually awesome, but what is not awesome about it is having to do it manually. And there are capabilities to do this in an automated way and even multiple times a day to provide true real-time views of what is in stock. Another benefit is the ability to have proactive expiration and recall notifications that tell you exactly where the product is that needs pulled. Soon to expire product can either be returned to the manufacturer or transferred to another department to use. Let's break it down a little further and look at some of the best practices surrounding the product lifecycle to enable these benefits. The most basic method can be a Kanban system, which often leverages the logic of 2 replenishment bins per SKU with stored PAR levels so no ongoing counting is required. This technique should be used almost exclusively for low-cost supplies where the focus is on ensuring high service levels and the least amount of labor to manage them. Now, barcode technology is still generally acceptable for low-cost items that require tracking at each level, and the new UDI regulations are ensuring manufacturers are applying appropriate barcodes to their products. One thing to keep in mind, though, is that barcode tracking as a complete system is challenging as it requires line of sight and many touches throughout the life cycle of the product. But outside of process compliance concerns, I would still encourage it for a small subset of products. Finally, RFID is inarguably the most effective method for high-value products such as stents or pacemakers. We typically recommend using RFID for products costing $40 or more, but we are seeing many providers tracking things well below that given how impactful RFID is to optimizing workflow. Let me give a little bit of background on radio frequency identification, though. The RFID I'm referring to is passive RFID, not the same time that manages pallets flowing across a shipping yard or large equipment traveling throughout a hospital. That's active RFID, and it works differently, and while effective for those use cases, it's challenged when trying to work in a surgical or procedural area where near-perfect read rate accuracy is required. To work, an RFID tag is placed on a specific item and fully associated with that item's product description, size, manufacturer tissue bank, lot number, serial, expiration, and can be tracked anywhere that RFID tag is scanned. Think of the tag becoming the product's unique license plate. Anywhere RFID scanning is available, whether in a storeroom or procedural area at the point of use, all that product information is captured and analyzed. You can now easily get real-time visibility to everything in your inventory. Probably the best part of RFID is that it enables your clinicians to just grab and go from product storage to use, essentially letting their most natural workflows take hold. But in addition to the core data capture methods for product storage, you also need to look at other success enablers. Take, for example, the point of use. This is actually probably the most important step as it is what defines when and how a product is actually used and can trigger processes for supply and clinical. Now, niche technology solutions may be intriguing and provide some critical value, but interoperability is essential to any provider seeking an enterprise platform. Inventory management solutions should be no exception to that philosophy. If fully implemented, your inventory solutions should interface with MMIS to enable product information sync, cost intelligence, automated ordering, and replenishment tracking. On the other side of it, you'll want to interface with the EMR capabilities that can enable ADT sync, charge capture automation, and cost per case intelligence by connecting all products used to a patient, physician, and procedure. Think of all this as a complete three-way bidirectional technology ecosystem between MMIS, inventory system, and EMR. Finally, with all this newly available data, you need to ensure you have a data and analytics platform that can support all of it. Having a robust solution means a dual-focused platform. It has to have a dashboard with real-time alert capabilities in order to take action on immediate needs, but it also has to have easy-to-leverage analytics to improve strategic decision-making. But at the end of the day, there's a pretty simple moral to all of this. Whatever methods or enablers you choose to leverage, they should be cost-effective, workflow efficient, and above all else, easy. Easy to implement, easy to train, and easy to use. So speaking of ease, let's look at a dashboard and some of the analytics. So this is an example of a dashboard integrated within a cloud-based system, accessible anywhere, anytime. It is designed to alert users to anything that deviates from the norm. It shows exactly what items are missing, need ordered, low on dating, recalled, exceeding consignment contracts, and all with easy red-green indicators so you know exactly what needs to be done. Users can even use this to search the exact location of stored products. It's probably the easiest way to immediately see what requires attention to kickstart the day's work, and for management, checking in on this type of dashboard can be an easy way to see if SOPs and workflows are being followed by the teams. These types of dashboards can enable users of any skill level to hop right in and take control, but let me show you what analytics can be available to drive some broader decisions. This type of high-level view can provide inventory stats and trends, but it's also important to let users have control of what views they want to see. Some users may want to compare different departments or look at various trends by manufacturer or track shifts in the consignment. While it's a high-level view, having some of these basic capabilities on hand have historically been hard to come by for many institutions. But users will also want to dive into more details, and the application should let them do so with ease. Here's an example of what more detailed analytics views can look like if someone wanted to explore supply cost per case across various procedures. These types of views detail trending costs and can even be broken down by location, physician, or by manufacturer. Utilization variability is high in this space today, and it's critical to have an objective platform that you can use with your supply and clinical teams to ensure everyone is on the same page and aligned on what actions need taken. Now, we all know many factors exist as to why physicians select various products, even down to the particular case and the acuity of a patient. However, without the data visibility, it's impossible to get on top of controlling it. Rami, maybe you can talk about how some analytics have given you better control of your products.
Absolutely. Thanks, John. Here are the initial results from our switch to automation using the RFID technology paired with analytics gathered 24/7. In order to justify our investment and manage the transition from manual to automation, internally we had a phased approach. Some departments had been implemented for 24 months, while others about 6 months into the process. This has allowed us a much clearer transition and aligned for our internal stakeholders as they get accustomed to the new process and new technology. So here's how we identified the first wave of departments and hospitals. Number one and key, combination of the right leadership, progressive mindset, willingness to adopt and embrace change, which would position them to be advocates to other teams across our IDN. Certain level of procedures, volume and size also were taken into account. Our thought was, if this can work in higher level departments, it gave us confidence the solution would be able to work in smaller departments as well. So within these departments, we have the following. Visibility to approximately $7 million in total inventory, both purchase and consigned. Inventory values at the department level. Visibility to our suppliers as well as the amount of product shared we have for each other. Everything was being tracked RFID. The key guiding principle was to ensure peace of mind to our clinical leaders. Right product, right time, no expiration, reduce waste. With the push for sound inventory levels results in reduction of waste and accomplish sound expense was our end goal. Let me show you how this working from power management perspective. As you can see, every department has some value. Prior to implementation, we had to define a PAR for all products. This was no easy task as we were relying on data obtained from manual processes. And in some cases, it was just the old adage of use one, replace one for supply replenishment. But it was the first wave to begin to get control of our inventory and execute. And here's what I mean by that. First, you have to have control. Having visibility to what you need and setting PAR to accommodate. Second, execution. Still frequently assessing and adjusting and sticking to it. As we all know, there are a lot of moving drivers across healthcare today, and the impact of the levels can change drastically. The end result was right size to your inventory. Now, over time, our system will recommend a smart PAR, or what I refer to as the ideal state, which we which may be more or less than what you used before. However, we were comfortable with the data to make decisions. For example, in the first quarter post-implementation in a department, major gaps would jump out to us. If we have 100 supplies on the shelf, we haven't used one of the 90 in days, there were clear gaps, and it happened to us quite a bit during transition. It simply takes a little bit of data and trust in the technology to make these changes. Transitioning to another pain point we had was managing expired products. Let's take a look. As mentioned earlier, we did not track pending expirations before switching to the automation simply because we didn't have a way to easily manage it. We look at the data in the past while looking ahead for a couple reasons. Number one, to achieve the overall decline in the amount of expired products on hand. Remember, we were still adjusting our PARs. These numbers give you a glimpse on how much expired products we had on hand in the month of January. As you can see, $30,000. To see where a product is expiring was key, and having the ability to move it to other departments before expiration was a must-have. I'm now able to do more predictive and better control of moving product around before it expired and was wasted. We've talked about our challenges and how we've addressed the problem. Let's look at how supplies has achieved total visibility. Here are some few high-level thoughts. We have seen a cultural shift. Transition from counting supplies to trusting automation. Our teams have visibility of supplies across multiple departments, across multiple hospitals. We have increased communication with data to drive discussions. We've been able to improve ordering and reduce waste. We definitely have been able to simplify workflows. And key to me was clinicians were spending less time on inventory and focusing on patient care within our hospitals. So here's a simple example that is not too uncommon. I often got panic emails for the thousands of dollars worth of Impella catheters that were about to expire, then having to call cath labs statewide to see who can use them. I can confidently tell you that this sort of issue no longer surfaces. Please also note there is a lot more work to be done. Our goals in the future are as follows. Continue to build a story across our cardiovascular and IR departments as we still try to tackle the operating room. Automation has to hit all critical areas across our enterprise. John, can you speak to the ease of the technology?
Sure, Rami. So let me hit on overall ease for a minute, as it's a theme we've been focusing on, and it's critical to have a partner who can make it easy. At Cardinal Health, we are committed to helping hospitals make it easy to reduce costs and allow more time for patient care. As a leading solution partner for RFID, with placements in more than 160 hospital locations, we have shown delivery of more than 200% ROI, which our partners typically experience within the first 6 to 12 months on the platform. Installations can even happen as little as 12 weeks start to finish. So I'll conclude with what I believe are the 4 components of a successful solution. The key is to focus on completeness. For example, take the management of high-value supplies in your procedural rooms. These are the 4 aspects of a world-class automated solution powered by RFID, and you should ensure you're covered for all of them. First, storage needs to be easy and in the right place to support workflows. RFID tag products are increasingly coming registered by the manufacturer, and they can also be applied by your staff in seconds. You heard me hit on point of use, and I'll do it again. It's critical to connect products to procedures for both clinical documentation and billing processes, as well as being available later for advanced analytics. Third, replenishment should be a breeze, and with interfaces into the MMIS, orders should be automatically triggered for reorder, which can be seamlessly processed or available for review by someone on your team. And last, all of that information must now be compiled and presented for real-time operational intelligence and for analytics such as PAR optimization and supply cost per case. Our solution can do all of these things, and we believe we can truly help providers along this journey. So on behalf of Cardinal Health Inventory Management Solutions and Centura Health, I thank you for your time today, and now Rami and I will take some of the questions from the audience.
Great. Thank you, John and Rami, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. So it looks like an audience member is wondering about the challenges driven by manufacturers. Can these automated solutions be tied to manufacturer processes? And John, why don't you start us off?
Yeah, I think absolutely, and at the basic level on the ordering and the replenishment side of it, obviously we talked about the interfaces with MMIS, and that can be automated either through ordering to the distributor, or it can be directly with the device manufacturer. But I think there's some other pieces too. One, being on the platform, and manufacturers can get on the same platform, it enables them to proactively support consignment. So they can either have visibility to exactly the dating of what's on the shelf, or the provider can actually use the system to create automated emails to go out at particular dating time periods to go to the manufacturer rep, so they know that they can come in and take those products off the shelf for their consignment agreements. There's automation around implant logging, and I would say from a manufacturer tagging standpoint, if they are putting tags on the product, it enables the provider to see all the way upstream to the point of manufacturer distribution, and it also enables that manufacturer to see that product down to the point of use, so everybody can be working seamlessly to reduce waste along the way.
Great. I think you make a great point, John. Thanks for clarifying. Rami, why don't you take the next one? An audience member is wondering, other than dollars, what other benefits can be seen from a better managed supply chain?
I would suggest to you with this technology, there are two basic qualitative tenets that come with this. The ability to manage recalls. I can probably say the majority of the folks on the phone can relate to the pain of managing recalls and searching through the hospitals. The ease of the technology allows the recall process to be seamless. I'd also suggest you the management of expiration of products. The management of expiration of products and the simplicity that the technology brings is a huge benefit outside of the dollars associated with the ROI.
Great. Thank you for clarifying that, Rami. John, let's go back to you. What have you seen as the biggest roadblock to adopting automation?
Yeah, I think what we've seen is very similar to what came up on Rami's poll question, which I don't recall the exact stat of where it ended, but it seemed like the majority of folks talked about that alignment. And I think that's where roadblocks can exist. They can also be overcome, but really it's about getting the clinical, supply, and the technology teams on the same page. And usually where we see roadblock is if someone's trying to champion a particular use case that may work only for clinical or supply or maybe on the technical front. And so it's really a matter of getting everybody aligned on what is the vision that they're trying to accomplish. And if they can get unification on that front, then it's easier to work down what's the right type of solution to solve for that works for everybody. And the only other gap I would say is maybe just on the budgeting process. We know that's hard. It popped up here, maybe a smaller percentage. I think it was less than 10%. But ensuring that folks can have a budget for these types of solutions isn't something that typically existed before, and part of the challenge is that if folks don't have capabilities to measure the data, it's difficult to understand exactly the materiality of the pain. So it's helpful to have a partner that can help you get up onto the platform and start seeing that value and getting that return on investment before major cost outlay is required, which can give confidence to the financial folks of the overall return on investment.
Absolutely. Thank you for clarifying that. So one audience member said interoperability is a major challenge with the amount of individual technologies in my hospital. Doesn't more technology just add to the chaos? And if you want to weigh in on that, John, that'd be great.
Yeah, I think at face value, more technology isn't always necessarily a good thing. So if it's the route of, hey, we're trying to bring in more solutions because there's some really cool tech out there, that's probably a failure point. I would say from our perspective on our solution, we look at, what's the product roadmap, and it's about workflow, it's about point of use, it's about data and analytics, and it's about interoperability. That is a critical lever, and I would say an automated inventory management solution that is not interface with the MMIS and interface with your EMR capabilities and has that level of interoperability is actually not a complete inventory solution. So I would say, yes, interoperability is a challenge. Yes, more technology can be more problematic than less technology. At the same time, if you're looking at it through a route of making sure that all of your ecosystem of tech is synced, then I think you'll be in a good spot.
I think you make a great point. Thanks, John. So, Rami, it looks like a lot of people are interested in your experience with the implementation process. How did clinicians react to the automation?
I think it's safe to say in healthcare, clinicians don't like change. And thinking through that, education, and I would suggest the group forcing or suggesting that we all need to lean into it together is key. So over time, education, awareness, making it a tool for everyone was able to get through the struggle and the barrier of the change. I would suggest to you today, clinicians are adopted to it, like it a lot more than they did initially.
Thanks for sharing your experience. I'm going to give you a follow-up, Rami. Another audience member is wondering, is there anything about the process of moving to automation that you wished you would have done or managed differently?
The big key element I put forth to the group is role clarity. What role does the clinician and what role does supply chain have with the use of the technology? Establishing that on the onset is key, and I wish, in retrospect, we had established that and educated our clinical departments as well as some of our supply chain leaders, patient safety officers, quality, and other key stakeholders, and IT on their roles related to the technology before we started to adopt it.
I think that's helpful for our audience to hear. Thank you. Another audience member said, thank you for sharing the different types of data you've been able to capture. And then they're wondering, how often are you sharing this data with your cross-functional teams, Rami, and what are their expectations for you?
You know, I'd put forth to the group that we've just scratched the surface on the data. Depending on the type of data that's coming out, whether it's regulatory review, patient safety, ability to forecast demand, I would suggest to you this is still evolving. So the frequency can range from daily for state review all the way to strategic discussions with suppliers.
Great, thank you for expanding on that. So it looks like we have time for one more question, and John, I'm going to turn this back to you for the final one. Are manufacturers starting to put RFID on their products, or does an audience member's hospital have to do that?
Yeah, answers both. I think we see many more manufacturers starting to adopt, advanced technology like RFID for many of their own use cases. We also see manufacturers putting tags on specifically for their partner providers only, and so it can be either a manufacturer putting on every product or a manufacturer putting on specifically for somebody who's on an RFID solution. At the same time, the providers will always likely have the option and need to put tags on some of the products that won't come tagged from the manufacturer. But I would say that's a very small couple of second step that then enables no more touches of that product on the go forward. So when we see folks that have somebody set up on their receiving area, pulling in the products, putting the tag on, and putting them away, they're still seeing a net benefit of about 3 hours of savings every day. So while there's an incremental step to putting that tag on the provider side, when you look at total workflow, there's still a lot of labor savings on that front.
Absolutely. Thank you for pointing that out. So that is all the time we have for today. I want to thank John and Rami for their excellent presentation and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.